Oral surgery deals with diagnosing, surgically treating, and following up on diseases of the jaw and related areas. Many dental instruments that we use in general dentistry are also used in oral surgery. Of course, the same patient record, the handpiece, the mouth mirror, and so on. And yet, oral surgery has its own unique elements that make it stand out from general dentistry. When oral surgery is a part of the general practice, the number of these smaller parts making up the whole grows greatly. That means your responsibility as a dental assistant does too. All dentists receive oral surgery training in dental school. Many dentists perform extractions, minor bone surgeries, and other procedures, and refer more demanding procedures to the specialists, the oral surgeons. Some dentists refer all oral surgery patients to the specialists. The decision to refer reflects the doctor's personal preference. Oral surgery goes well beyond just extracting teeth, though. Biopsies, implants, and the correction of fractures or defects are most often referred to oral surgeons. Needing the procedure is hard enough on a patient, much less finding that he has to see a new, strange, and unproven, at least to him, doctor. Your ability to reassure becomes of great importance. Patients are often under a great deal of strain when they visit the dental office. Recommending that they see an oral surgeon doesn't help any. However, they are generally agreeable once they know the results. Just help them understand that special instruments and anesthesia, or even the oral surgeon's greater skills, help make the referral necessary. After reassuring the patient, your role during oral surgery as the dental assistant includes gathering the needed materials and instruments, preparing the treatment area and the patient for the surgery, assisting the dentist in the administration of the anesthesia, and even monitoring it when it's legally allowed, helping the doctor during the procedure, cleaning up the treatment area and the patient afterward, and recycling the instruments and the treatment room, preparing them for the next patient. In addition, follow-up visits may require that you remove sutures or surgical dressings or make x-rays. In short, you're the patient's ally. You're his support representative throughout the course of care. Successful oral surgery begins well before the day it's scheduled. A complete and accurate medical history, including any needed pre-surgical tests, must be gathered. You'll have some role in this, the least of which may be updating an existing history and the medicines the patient is taking. Explaining the procedures to the patients is increasingly becoming one of the dental assistant's duties. This is wonderful. It frees a doctor from the task and allows him in the practice to serve more patients. Depending on the type of surgery scheduled and the anesthesia to be administered, pre-surgical instructions vary. Each dental office has its own instruction sheets to give to the patients before surgery. Generally, patients are instructed not to eat solid foods after midnight on the night before treatment. Also, they should take any recommended pre-medications, and they should bring someone with them who can drive them home. Even if deeper anesthesia is not planned, some patients feel incapable of driving after oral surgery. As mentioned, oral surgery procedures use some instruments and techniques based in general dentistry. There are additional items needed that guarantee surgery patients receive proper care. As with all dental procedures, a basic dental setup is included in the oral surgery setup. Extra paper goods are also used, including cotton rolls and gauze to help control bleeding. The doctor may use an opened 4x4 sheet of gauze as a throat pack, lightly draped behind the teeth. This prevents a patient from accidentally swallowing or inhaling a foreign object. Some oral surgery procedures can be provided using just a local anesthetic. Applying a topical anesthetic a few minutes before the injection helps increase a patient's confidence and also helps diminish fears. The proper anesthetic, usually one with a vasoconstrictor like epinephrine, plus the syringe and the needle preferred by the doctor must be available, but always kept from the patient's sight. Since profound numbness is desired, extra doses of the anesthetic may be administered over what might be used in more general dental procedures. Some oral surgery procedures require deeper anesthesia than what a local allows. It's these cases when your doctor may prescribe an oral premedication, which may be coupled with the use of nitrous oxide in the office. Other dentists provide conscious sedation, which is also sometimes called twilight sleep, using an IV. Unless you've had special training and certification, and depending on where you live, you shouldn't be expected to directly participate in these procedures, aside from in a dental assisting role. The instruments that we use in oral surgery can be very intimidating, not so much to you, but maybe to the patient. Remember to keep all of them out of sight until they are used. While the various shapes and sizes may seem confusing to you at first, think about what the instrument is intended to do. What you seek for a certain procedure will soon become automatic. Before the patient is seated for the surgery, all needed instruments must be gathered and the treatment area properly prepared. Drape and disinfect all surfaces as described in the infection control film. Oral surgery doesn't demand enhanced infection control techniques. The same high-level degree of asepsis must be provided in every aspect of dental care, not just oral surgery. Once you're aware of the planned treatment, have gathered and covered the materials needed, prepared the treatment room, and placed the x-rays on the viewer, the patient may then be seated. The patient is seated comfortably, and then properly draped and positioned in the chair. This is a good time to verify that they haven't eaten anything as requested, and that they've used any necessary medicines beforehand. Finally, their health history is reviewed one more time. Some practices ask them to wash their face with surgical soap and rinse, and dry with a sterile towel or gauze. You can then elect to place a towel about their neck, reassure the patient, and briefly explain the procedure. Your preparation begins with being familiar with the treatment. This familiarity comes about through practice and attention, and is what will help calm the patient even further. Finally, you should put on the proper personal protective equipment according to the demands of the Universal Precautions Guidelines. Again, review the film on infection control if you have any doubts about the proper sequence. Watch as this assistant demonstrates placing the gown, mask, safety glasses, and gloves. Let's discuss the instruments that we'll use in oral surgery, in the sequence of use, and walk through a procedure like an extraction. We've already mentioned the basic setup, which the doctor used in the examination, and we talked briefly about anesthesia. Now the treatment is ready to begin, but first, make sure the patient knows that feelings of pressure or grating or cracking sounds during the treatment are perfectly normal, caused by the tooth being gently released from its socket. Before a tooth can be released from the grip of its socket, the gum tissue surrounding and attached to its neck must be released. The smaller end of a periosteal elevator is used. The doctor first assesses the degree of anesthesia using the sharp tip of the elevator or an explorer. The elevator frees the tooth from the gingiva using its wide, flat blade and prevents tearing the gums during the extraction. Next, and quite contrary to what most people think, the majority of the extraction process takes place not with the extraction forceps, or pliers as patients call them, but with a tooth elevator. This instrument is placed beside the tooth and used like a lever, loosening and releasing the tooth from the thousands of small ligaments that anchor it in its socket. Its handle is designed to give the doctor a comfortable, secure grip. Straight elevators work well for front and side teeth. Back teeth's intricate root anatomies and the difficulty of accessing them require using special angled elevators. For example, the Cryer elevator has a pointed triangular tip that engages and lifts a tooth better. Select a left or a right side elevator depending on the side of the mouth being treated. Some elevators, like a Potts, have crossbar handles that help improve lifting power. Finally, the tooth is removed. Extraction forceps grasp it and safely lift it from its socket, hopefully in one piece. By luxating the tooth, or rocking it back and forth, the socket is expanded and the tooth is released. The beaks of the forceps and its handles help identify which teeth it can be used on. Some forceps, like the number 150 for upper teeth, are universal, meaning they can be used on either the right side or the left, or even in the front or the back. Others allow access to and really only work on one side of the mouth. Examples include a number 3R for upper right molars and a number 3L for the upper left ones. Again, the particular elevator and extraction forceps needed depend on the tooth being removed. It doesn't make sense to have all of the office's elevators and forceps out for every oral surgery procedure. Thus, it's very important to develop your familiarity with the instruments and when they're used. Various extraction forceps include the 150, which can be used for nearly all maxillary teeth, the 151, which is its counterpart for the lower teeth, the cowhorn extraction forceps, appropriately named, practically lifts the lower molars from their socket when its beaks are squeezed between their roots, and it can be used on either side. The doctor examines the extracted tooth, noting missing roots, root tips, or the presence of sharp bony projections. If surgery is needed to correct bony defects, the bone must be safely accessed and exposed first by reflecting the gingiva. Beyond the gum tissue attached to the necks of the teeth, the wider blade of the dual-ended periosteal elevator is used to separate the thinner and more delicate gum tissue from the underlying bone. If the gum tissue must be laid back surgically to reveal needed surgery, or when a tooth's root breaks and must be surgically removed, precisely cut surgical flaps minimize tearing the gum tissue.